Hello everyone, I'm Dr. Manish Singhal, medical oncologist at Apollo Hospitals, Noida and Delhi. And today we are going to discuss a very important subject, which is the facts and fiction about lymphedema. So before that, this is after breast surgery and when axillary lymph nodes. Usually in a breast surgery, you not only remove the breast or a part of the breast, you also remove certain lymph nodes in the armpit. And because of this, a very important risk develops, which is called as lymphedema. We know that whenever lymphatic supply which goes from the hand back into the system goes through the axilla and the axillary lymph nodes, and whenever you resect these lymph nodes which are there in the armpit, there's a risk of developing a lymphedema. Lymphedema is a very hard swelling of the hand on the same side where the breast surgery is done. It is not a simple soft swelling, it's a hard swelling. Or it is also called as elephant-like hand, which becomes so heavy and it can really cause problem to the patient after their entire treatment has been done. It is quite possible that patient get cured of breast cancer, where the cure rates are very high, in excess of 80%, but you are living with one arm which is slim but one arm which is so thick, and you're not able to wear clothes because you have to stitch different clothes, and as such your arm movements get impeded. So it's a real risk, there's no doubt, and it also depends on how extensive surgery has been done in the axilla as compared to less extensive surgery. So much so that the risk is so real that many a times we have started doing lesser surgery in the axilla to safely omit the risk of lymphedema, which is called as Sentinel lymph node biopsy. Yet there are a lot of misconceptions regarding lymphedema, and I am here to bust those misconceptions. We have done a lot of research and what is evidence-based literature which talks about lymphedema. So first and foremost is, many people tell them that you're not supposed to lift any weight from the arm that has been operated or the side which has been operated, which is not true. As a matter of fact, there are studies which have been published in New England Journal of Medicine where graduated weight training from that arm can actually decrease the risk of lymphedema rather than increase the risk of lymphedema. But it has to be done with an expert, with an expert physiotherapist. It's not that you cannot pick up weight. You can definitely pick up weight, rather you should be doing weight. And there has been studies that a graduated weight training, as you gradually increase the weight, you can actually strengthen the arm and decrease the risk of lymphedema rather than increase the risk of lymphedema. The second misconception is taking a flight. I think the entire world is now traveling by air at least at some point in time. It's so very important to travel, not only to enjoy, to meet family and friends. And the concept is that not to either take a long haul flight or even a short haul flight, and even if you have to do so, you have to wear a compression stocking. It is possible that in case you may just forget and then remain stressed that you didn't wear a stocking, and now you'll encounter a lymphedema. There's no evidence in literature to suggest that wearing a stocking during a long haul or a short haul flight can result into increase in the lymphedema. As a matter of fact, it can be counterproductive, and there is good evidence to suggest that. So you can easily take a flight without any fear of increasing lymphedema. Third most very important question is whether they can shave their underarms or they can do a waxing of the underarm. It is absolutely safe. There is no reason that a female cannot shave the underarm. Of course, it is important that you should not get a cut. So a trimmer is good, and you should not get injured while getting a waxing done. So it's absolutely safe to get hair removed from the armpit, but you should not get yourself injured, because that injury can lead to cellulitis or infection, and that infection can definitely result into increase in lymphedema. After this, the most important thing which comes to my mind, that is the fourth point, is blood pressure measurement. Many of these patients, they're elderly, they have blood pressure problems. As a matter of fact, now even younger people get breast cancer, and they can also have blood pressure as an important issue. So there's no harm in getting a blood pressure measurement done. There has been a lot of studies published in Journal of Clinical Oncology, which you are seeing over here, published in 2016, where they not only checked a lot of patients, whether not only for blood pressure monitoring, but also blood draw. It's not that if you have suffered from breast cancer, you'll not suffer from anything else, or you can't do a health check and you have to do certain blood test. It is absolutely safe to draw blood in a clean manner and also do a blood pressure monitoring. Yes, blood pressure monitoring can definitely impede the blood flow for a certain while, which is about a few seconds, but this does not lead to increase in lymphedema. Of course, when I say this, you should not be having already some lymphedema in that arm. If you're not having any lymphedema in the operated arm, then you can definitely do blood pressure monitoring and also do blood draw for routine health checkups, etc. Now coming to the to another important point, which is like venipuncture. Venipuncture means or having a cannula or an IV device to give IV fluids. Of course, it is always important that should be avoided, because getting a cannula or an apparatus inside your arm to get IV fluids or some injections to be done in that particular arm, or some fluids or some injections like antibiotics or something, that should be avoided. The contralateral arm should be used. However, if you are not able to get a cannula in the contralateral arm and you have to give some simple IV fluids or simple antibiotics in the same arm, it is not a great idea to keep puncturing the contralateral arm or the other arm repeatedly. If there's a clean vein which is visible on the operated side, it is okay. If you don't have any lymphedema already present, it is not a great idea to puncture the leg veins for IV access. So, in short, there is no evidence in literature to suggest that if you take a IV cannula and you take some simple fluids, it is risky. Of course, there should not be any extravasation in the vein, and it should be a clean puncture in a single prick. If you put a IV cannula for IV infusions, it is okay. Of course, the preferred is doing it in the contralateral arm. Dhanyavad.